Which of the following is the most likely diagnosis? Allergic rhinitis, chronic sinusitis, migraine, nasal polyps, and rhinosinusitis. A 35-year-old woman presents to the clinic with a 1 week history of nasal congestion, facial pain, and thick yellow nasal discharge. She reports that her symptoms started as a common cold and have progressively worsened. On the physical exam, her blood pressure's normal, heart rate's normal, and she has tenderness over the maxillary sinuses. So then we're looking at the diagnosis. Um, this clearly suggests, I think, some kind of sinusitis. I think because it's a cold that's gotten worse, it makes me think more chronic sinusitis. We're up to the 1 week. By 1 week, she should have at least be improving, and it's getting worse. So I think it's a chronic sinusitis.
Final answer.
Yeah.
So
Okay.
so yeah, so this is kind of an interesting question. So chronic sinusitis is usually greater than 12 weeks.
Oh, okay.
Okay. So that's just, I mean, that's a very ENT specific question, right? On a timeline basis, right? You have acute sinusitis, which is less than 4 weeks, and then subacute, which is 4 to 12 weeks, right? But chronic is more than 12 weeks. But then let's kind of break this down a little bit, right? So allergic rhinitis just means exactly what it means, right? You get hit with pollen, you get hit with mold, and then you have runny nose, right? Or inflammation of your nose causing runny nose, usually clear or yellow discharge. Um, Chronic sinusitis, like you said, you have facial pain, decreased smell, swelling, things like that for more than 12 weeks. Migraine doesn't really fit here, right? Usually get, one-sided headache and radius behind nasal polyps, right? You have nasal obstruction, you see polyps in the nose, and then you have rhinosinusitis, right? That just means the nose and the sinuses are inflamed, right? And so rhinosinusitis can either be viral or bacteria. So if you pick this answer, you kind of cover both your bases here. So,
Fair. Okay, that makes sense.
all
It's
right.
just a definition thing.
Yep.
Okay.